Hello, my name is Maureen Avamata from the Philippines. As a woman with disability and a bone cancer survivor of 33 years, for me, health is very important. Health is wealth. But there are certain questions that we have to address because it's what I have experienced before or during those times when I needed medical assistance, when I needed to access the health services in our community. Number one, are our health services available in our community? Number two, how can we be able to get to the health center or be able to avail the health services, not just in the health center, but of course in the hospital? Another thing that we have to consider is that are the medical people aware of how to assist or communicate with us? Number four is the connectivity, or how can we get out of the house going to avail of this medical services or the health services that is available in the community? Do we have a safe, humane, accessible, inclusive transportation system? To ensure that we are being heard or to ensure that we can access health services, it's very important that those questions that I have raised a while ago be addressed. It's not enough that we are just invited to attend meetings for or for awareness raising. It's very important that our voices be heard. It is very important that we are part of the table, that we have seat at the table. It's important for us to ensure that me as a woman with disability, but in general, persons with disabilities and other vulnerable people or vulnerable sectors are included, not just in the planning, not just in asking about what are our needs, but in the entire cycle to ensure that nothing about us without us. For us to have a healthy beginning, our voices should be heard. We should not just be an afterthought. Planning for us to have an affordable, appropriate, accessible, and inclusive health services. As I always mentioned, we should be part, not just tokenism, not just a symbolic inclusion, but the true meaning of inclusion. For us to be able to be part, we should be provided with reasonable accommodation in our accessibility needs so that we will be able to actively, effectively, and meaningfully participate on an equal basis with others. In commemoration of the World Health Day, having a healthy beginning, including us, will definitely hold a hopeful future for all of us. Not just for persons with disabilities, but of course the other vulnerable sectors wherein we are included in the entire community. And in this, ensuring that no one will really not, no one will be left behind. Thank you.
Greetings, everybody. Thank you so much once again, just illuminating some of the tech challenges that we had with regards to streaming on Facebook. But however, we will make sure to upload the recording to ensure accessibility, knowing full well that there are folks that might only have social media data bundles. And so that being said, greetings everyone. My name is Dumiso Gacha. We're currently live streaming via YouTube. Thank you so much for my speakers joining us today. I know that everyone is quite busy, but also it is quite trying times, and there's so many different challenging issues that I hope that we'll be able to unpack as we explore this conversation over the next 15 minutes or so. And so that being said, I'm going to maybe ask each of my panelists to introduce themselves and briefly sort of highlight some of the work that they're currently engaged in, and also why it's important for us to commemorate World Health Day. And so maybe let me just start with Smitha. Smitha, please do introduce yourself all the way from India. Please let us know what you're currently working on, and then also just illuminate why it's important for us to commemorate World Health Day.
Hi, thank you so much, Dumi. Am I audible? Am I audible?
Yes, thank you.
Great. So, yes, World Health Day as such is very important for us. But so what is our message, or what is our status, or what is it that we want as health, and why it is crucial that this message should go into
Smitha, maybe the connectivity might not be ideal. Could you maybe switch off your camera? That might be a little bit better.
Yeah, how about it now?
Perfect, go ahead.
Thank you so much. What is it that implies health for us, and what is the message that we want to give commemorating this World Health Day is very, very crucial, and we need to contemplate on it, because we are all striving for health, and which is not just some services, whereas it is the holistic approach towards health and well-being. So where is the well-being? It is in the body, it is in the mind, it is in the environment, it is in the emotions, it is in the conversations that we exchange, and it is the way that we treat and we are treated by the society. So a lot of it is embedded into the attitude of the society, and then into the societal barriers, including attitudinal barriers, environmental barriers, physical infrastructural barriers, informational barriers, communicational barriers. So how can the health system, help in removing those barriers, so that we can experience the real health? So this is something which we need to contemplate on, and many thanks to the speaker who put it very, very nicely, and absolutely all the she mentioned about transport is not accessible, or when the
Sorry, Smitha, it might have dropped a little bit. So I'm going to invite...
I am back.
Oh.
I'm back. Sorry. I think there is some network issue. So those kind of aspects we need to rethink, and she rightly mentioned about sensitization of health professionals. So while call for sensitization, what is it? Is it just our bodies? Sensitization of the bodies and the issues that we have, and how it needs to be dealt or managed or treated, or is it more beyond how we should be looked at as a holistic human being? And what is the kind of respect, the sense of respect, sense of equality, and the sense of acceptance of everybody as part of human diversity, and then celebrate human diversity, that is what I would call as the real health. Because otherwise, if it is just
Oh my goodness. Sorry, I'll bring Smitha back in. Albertina, may I call on you from Eswatini to briefly introduce yourself and then also mention why it's important for us to commemorate World Health Day. Albertina, please.
You're on mute, Albertine.
Sorry, thank you so much to me. As mentioned, I'm Albertina Nyati from Eswatini. I work for an organization called Positive Women Together in Action, which is an organization for women and girls living with HIV and those that are TB survivors. Why should we commemorate World Health Day? We should commemorate World Health Day so that we are able to take stock of where we have been and where we are going, because it is important to sit down and note the things that we've done and also map a way forward as to look at where we are going, what are the other things that are needed. We also need to ensure that the services that we are giving out to people, are they available? Do we have services? Do we have even medications? And if they are there, are they tailor-made for the people that need them? Because sometimes we do have services, but like we say, some of the services, they leave some people behind. So we should commemorate World Health Days to ensure that we're not leaving anyone behind. Our services are reaching everyone, every vulnerable person that is out there, including the key population. And then also we should also ensure that even the policies, we have policies that put the patients or the, the communities at the center, and they are tailor-made for them so that we are able to ensure that we have reached uh, everyone, and even those that are always forgotten, like the disabled people, because sometimes we do have services, but you find that the services, they're not, we just do one size fits all services, and then such people like disabled and other populations are then left behind. And also, like it has been said, are these services having an impact um, on the people that they are getting them? Because sometimes we say we have services, but are the services having an impact? Are we really making an impact on the people that are supposed to be getting the services? Because I'll make an example that sometimes we say we have services, but you find that most of our services, they are in the urban areas. They are not there in the rural areas. The people in the rural areas are struggling to get services. Yet we are saying services are there. So we should commemorate World Health Day so that we ensure that the services are in place. They are targeting the right people, and we're also having the impact from those services.
Thank you so
Thank you.
much. Thank you so much, Albertina. I'm going to bring Theo in to maybe just share just quick introduction on yourself and why it's important for us to be commemorating World Health Day.
Hi, Dumi. So my name is Theo from Zambia. I'm a queer feminist and LGBTQ activist. I feel it's very important to commemorate World Health Day, especially in a country like Zambia where we don't have so much being done about queer health. I have worked in the SRH sector. We have tried to provide tailor-made services for especially LGBTQ female-bodied people. And we have seen how drastic our health services are towards minorities. So I feel like Albertina that it's important that we kind of see the gaps that we have tried to cover and see what else we need to do, how many more steps we need to get to till we conquer the mountain. And also just to raise awareness about how marginalized sections of the society are not able to access proper health services, whether it's in the rural areas or in the urban areas. I have found that marginalized populations face the same challenges when it comes to accessing health services that are supposed to be freely given and provided for. Yeah.
Great. Thank you so much, Theo. Alia, I'm going to invite you. Please do introduce yourself, the work that you're currently engaged in, and why it's important for us, particularly as a global community, to commemorate World Health Day.
Thank you so much, Dumi. Hi, everyone. My name is Alia Amimi, and I work as a gender advocacy lead with the Women for Global Fund. I'm really honored to be here with you today and to speak on behalf of Women for Global Fund. So we are a global movement led by and for women in all of our diversity. And we actually advocate for gender transformative approaches within the health programs, but specifically related to the Global Fund to fight AIDS, malaria, and tuberculosis. We try to push for more fundings directed to women-led movements, to gender transformative programs. So commemorating World Health Day for me is not just symbolic. For me, it's a moment to, recommit with all the stakeholders, all of us, to justice in health. And it's also a call for access to health that is not shaped by gender, geography, sexual orientations, or race. It's about talking about the rising inequalities that we are seeing currently, the anti-race, anti-gender movement, and also the threats to human rights in general. And with the shrinking of the civic spaces for civil society, we cannot currently afford to leave anyone behind. So I think it's a great opportunity, and I thank you, Dami, for creating this space for us to talk about those who are often silenced in terms of accessing health services, and to remind that decision makers that we cannot achieve global health without gender justice. And I think it's really important, specifically for our movement currently, because of the aid replenishment of the Global Fund, where we have to advocate for more fundings that are really directed to women-led movements and to gender equality in general. And thank you again.
Thank you so much, Alia. And now I'm going to move all the way to Latin America. Luz, please do introduce yourself, the current work that you're engaged in, and why it's important for us to commemorate World Health Day.
Hi, Dumi, and hi, everyone. Thank you, Dumi, for gathering us in this such a meaningful conversation. Well, my name is Luz Reidel. I live in Chile, a tiny country in Latin America, far south, and work in Corporación Miles. We are an NGO that works mainly in promoting and defending sexual and reproductive health and rights. Taking that in mind, I was thinking about your question, like why to commemorate this such an important date. And I think we in Latin America are speaking a lot about life projects for women in general, but especially for girls and teenagers. And I think we cannot, as Alia said, have health without gender justice, but we will not have gender justice without the access to health for girls and women in general, because that's fundamental for the access to achieving a life project that is meaningful, that is properly owned by each one of us. And it translates in a lot of health, the access to health issues that are really restricted, not only in Latin America, but I know in Africa too. I had the luck to be in Kenya last year, and I realized how similar we are. We are so far away, but we are so similar in a lot of ways because we face the same oppressions. The patriarchy, the colonization has been what has been marking our paths of lives, and we have restrictions on abortion, on menstrual rights, the obstetric violence. All of these are issues, amongst many others, on sexual health and reproductive rights that mark the life of the little girls, and so it marks the life of us as adults in the future. So I think there is no gender justice without health, and there's no health without gender justice.
Thank you so much, Luz. And I think, it was quite important, just capturing all these different perspectives, and also mention that, even just having others who contributed, for example, from the Democratic Republic of Congo, as well as Uganda, I think it was very important for us in just sort of recognizing that, the importance of this, South to South solidarity. And so just speaking of colonization, I think maybe I'll bring in Theo just to ask, the reality is that many of our countries, particularly Commonwealth countries, have inherited colonial laws, essentially criminalizing and effectively state-sanctioned policing of the bodies of diverse women and girls. And I guess maybe, the question is, in criminalized environments, or in environments where privilege and patriarchy are prevalent, in environments where violence is not only state-sponsored in terms of ensuring or allowing impunity, but also recognizing that there's so many variant forms of violence that are pervasive across, diverse women and girls' lives. And so then the question really is, in these kinds of very difficult operating environments, how can we ensure that no woman and girl, no diverse individual, no person with a disability is left behind in the context of public health, especially in these very trying times with reduced resourcing? Theo?
Hi, Dumi. So in a context like Zambia, the best way we have been going about it is by raising awareness and demanding spaces with government officials, policymakers, ministers, MPs, and the like. It's been quite difficult. We have also tried to do some sensitization trainings with health practitioners, health workers, also the police, because we have a very high number of GBV cases. If you're anywhere near Zambian news right now, there's an escalating number of sexual and gender-based violence cases, especially against towards female-bodied persons and children. So we're trying to raise awareness on how all this colonialization and the patriarchy has made, I'm not apologetic to say, has made men so unaware of the dangers that women, girls, children face, even in the health sector. We have female-bodied intersex people going to seek health, and they are subjected to what I'll call scrutiny. That is very embarrassing. We've had cases where somebody goes and they don't know what's wrong with them, and healthcare personnel will call each other and make a whole parody of this. So I think our fight has been to raise awareness through different platforms. At this point, I'm trying as much as possible to use my social media to bring awareness to what's happening, what has been happening, and what will continue happening if the whole country doesn't just stand up and fight against SGBV towards women and girls. Yeah.
Thank you, Theo. And I think also that's just a stark reminder that, I think in the last 2 years, we've had the African Commission on Human and People's Rights Resolution 552 that specifically addresses the human rights of intersex persons in Africa. And I think it's very important for us to just sort of recognize and acknowledge the fact that there are communities that are left behind, even within the context of, progressive spaces. That being said, I'm going to try and bring you in, Smitha, to maybe just share, where do you think that there is hope to ensure inclusion, especially through universal health coverage? And I say this because, we've seen so many different things emerged, whether it's from the World Health Assembly or whether it's even just with the outcomes of high-level meetings at the United Nations. And so we've seen certain, I guess, commitments publicly, where heads of state, ministers of health, have been quite clear in universal health coverage being an aspiration that every country should strive for. In terms of implementation, we don't know what that might look like, but I guess, Smitha, the question really is, how can we make sure that universal health coverage includes everyone, particularly around disabilities, particularly around minorities? Smitha?
Right. Thank you so much, Dumi. So yeah, the commitment is there, global commitment is there, but how do we implement it? When we come back to our countries. So what is giving us hope is our own unity. It should not be like persons with disabilities separately, elderly people separately, communicable and non-communicable diseases groups separately, but we all should join together as one hand and advocate with the government. And already some of us or many of us are doing it. The next agenda, it should be just one demand with the government, where it should be fund allocation, because there a lot of talks happening, but when there is no fund, nothing is materializing. So fund is the major source which every government should allocate for all the marginalized communities. And next, the UHC's pillar of strength lies in the community, in primary healthcare centers. So strengthen and streamline the primary healthcare centers so that it respects the marginalization, and it accommodates all the needs of persons from different marginalized communities, different vulnerable communities. And so sensitization or accessibility, everything around that builds up. So the first thing is funding, and parallelly, I won't say call it as second, parallelly, simultaneously, what we need is also a community based approach, where it can be person centered care or it can be community care, where the health system should engage us. So these two things I think is very important.
Thank you. Thank you so much, Smitha. I'm going to turn to you, Albertina, especially because I know, Theo had mentioned, sexual and gender-based violence being a scourge. And I think, there's so many different countries where everyone can speak about the urgency and just the crisis that so many women and girls are experiencing. I'd like to appreciate, maybe if you could share, what are some of the experiences on the ground in Eswatini that, women and girls living with HIV are experiencing in the context of gender-based violence, and if there are any opportunities for us to essentially advocate for the integration of gender-based violence responses in health, to advocate for ensuring some of the other examples that I think Luce had mentioned around obstetric violence to be integrated in health, to ensure that the absence of sickness isn't just the only primary concern for decision makers and health practitioners, but that to ensure that there's all forms of safety, mental, physical, social, cultural, and religious. Please do just give us some of that insight coming from Eswatini. Albertina?
Thank you so much, Dumi. Gender-based violence in Eswatini is widespread, with 1/3 of the girls experiencing sexual violence before the age of 18. And this has an impact on the survivors, because they face sexual and reproductive health consequences, including unwanted pregnancies and sexually transmitted infections. Also, we also see that gender-based violence does not also affect women and girls, but it goes also to the key populations, where we see issues of homophobia. There is a lot that women are suffering from with regards to gender-based violence. We've seen women living with HIV when they disclose their status. We've found that they are uh, beaten or chased by their citizen and chased by partners. And then this makes it difficult for people to disclose their statuses. And then also with issues of disabled women that are living with disabilities. We've also had cases of gender-based violence where some of them they were sexually assaulted, and also some of them you find that they're not treated the way they're supposed to be treated. So it's a lot. There's a lot of gender-based violence, and then we still need to continue to ensure that we educate our communities on issues of bodily autonomy and integrity, where we educate people to respect um, people's bodies and also respect the choices that people make instead of beating those who are gay. We should learn to respect people's bodies, stop xenophobia, and also the issue of femicide. These days we're seeing a lot of femicide in Eswatini, where partners are killing each other, especially men killing women. So these also are the issues that makes it difficult for people to live a healthy life, because with gender-based violence, there's a lot. You don't know what is going to happen today. There is rape, there is homophobia, there is femicide, and we still have got a long way to go in order to make sure that this is kept. So for me, I would lobby government to address disparities and tackling the systematic barriers that ensure that marginalized groups and also especially disabilities, those living with HIV, and then also the issue of community engagement. We should ensure that community we involve women and girls and also the LGBT communities in decision-making processes to understand their unique needs and co-create solutions. And also with the universal health coverage, we should ensure that our governments ensure that the healthcare systems cover all individuals without financial hardships. Because we find that some, especially women living with HIV and those with disabilities, they don't have money to go to hospitals, or also especially going to those hospitals that are having um, all the equipment that is needed. So they should ensure that they involve them in they support them and ensure that the issues of stock out of medications they come to an end. And then also we should ensure that we also tackle the issue of mental health, because as women and girls and also the LGBT communities and disabled people face the challenges, these challenges has got an impact on the mental health of those people. So it's we should ensure that we we have services that addresses mental health issues. And then also, I was talking with we were having a meeting with the members of parliament, where members of parliament, they said, when we were talking with them, they talked about, we're always saying they should pass laws that are like this and this. So what they said to us is that their work is to pass laws, but they are sitting in parliament and the civil society is not doing their work. They are saying there are no laws that we bring to them to pass. So this gives us I don't know, this so that we should go back and sit down and craft the laws that are going to be tailor-made for us, and then send them to parliament for parliament to pass them. So that is all I can say. Thank you.
Thank you. Thank you so much, Albertina. And it's very critical. And the fact that you say that you have an opportunity where your members of parliament are literally asking for model laws or are asking, from civil society to sort of contribute towards that, I think it's very critical. And I think, just given the fact that there's just so many different experiences that have been shared around violence, whether it's in times of crisis or it's in more stable African countries, it couldn't be more important having the African Union Convention on Ending Violence Against Women and Girls. It couldn't be more important that we've just had a little over a decade of Resolution 275 of the African Commission on Human and People's Rights that speaks to protecting LGBTI individuals from various forms of violence. I'm going to bring you in, Luz, and basically just sort of ask, would you say, given the fact that you obviously have experienced the UN Civil Society Conference in Nairobi, and then more recently with the Commission on the Status of Women, would you say that there is meaningful representation of diverse women and girls in policy making, and that we can get some of these safeguards, particularly in ensuring whether it's political declarations or whether it's negotiations of member states in some of these decision-making bodies to advance the rights of women and girls, especially because SDG 3 and SDG 5, so health and well-being and gender equality, will be reviewed at the upcoming high-level political forum in New York in July. So do you see that representation is reflected in participation in these mechanisms? And then more importantly, is it meaningful representation? Because we know that representation sometimes isn't always so meaningful or even reflective of experiences on the ground.
Thank you. Thank you, Dumi, for that question, because that's one of the topics that have been obsessing me lately. We talked about that in New York with Dumi in a panel also. And it's how do we make these spaces meaningful for civil society and reflect our knowledge, not only our needs, but our knowledge that we have constructed through years and years of work. And I think it doesn't depend on us. And that's for me like the very first thing that I want to say, because we take the opportunities that we have. Albertina was giving a very good example on how when we are asked for something, we deliver. We bring everything that we have to the table, and we make sure that we can make an impact on the opportunities that we do have. But especially on the international level or global level opportunities, I think we must address two very meaningful topics for our participation. First of all, the financial issue. And I think we are in a point of history that, yes, we have a lot of connectiveness and we are able to speak to one another via Zoom, and that's great because it has opened a lot of opportunities. But there is nothing more meaningful than to be on the same room with the people that's making the decision at the time that they are making the decision. And I think that's a very important difference. All of these conventions and outcomes from these high-level political spaces are decided between four walls and on the 99% of the cases without we knowing what's going on inside of those places. And of course, money is one of the, I think, principal barriers that we face when we want to be in those spaces. But the second one is the capacity that we have to be there because of the bureaucracy of the global spaces. And for those of you that are not familiar with that, to be inside the rooms of UN, you have to be in a special status as an NGO to have access to the rooms, to the conversations. And it's not easy to achieve. It's not like we just fill a form and we are accepted in there. We have to present a lot of paperwork and we have to go through a process that it's not easy for every one of us because we have different time doing our work, because we have different levels of formality on the work that we do. So that's a barrier that's very important. And I think we have to work together to give each other spaces to be in those rooms, even though not all of us are formally there. In Chile, we've had a very successful experience through these last 3 years, but this year was the most massive experience because the delegation from Chile to be in the CSW, the Convention on the Social Status of Women in New York, our official delegation opened space for the NGOs to be on the delegation without any money involved. Each one of us had to finance our participation, but that opened the space to many 22 actually NGOs that couldn't be there otherwise. So we have to be like creative and think outside of the box so we can open spaces not only for us, but for one another and for each other.
Thank you so much, Liz. And I think that's very critical. And speaking of financing and speaking of trying to find innovative ways for leaving no one behind, I'm going to bring you in, Alia, maybe just for us to sort of appreciate. I mean, firstly, also you're from Morocco, so it would be a missed opportunity for us not to appreciate the progress or shortcomings that are currently experienced in the gender or women's rights movement. And then also maybe if you could sort of just shed some insights in terms of, how can we quantify some of our work? In our own GBV work, we've now learned that it costs almost 2% of a country's GDP. And if we use our 2022 estimates in Botswana, that is almost 400 million US dollars per year, and this for us is an economic argument for countering and addressing gender-based violence. Similarly, when we think about the impact in being one of the highest disease burden countries, along with South Africa, Eswatini, and a few others in Africa, Botswana can actually attribute a reduction in 2% of our GDP growth as a result of AIDS-related deaths. And this is just from an estimated more than 360,000 people living with HIV in Botswana. And so, Alia, it would be great for us to sort of appreciate just the context of your home country, and then also just, helping us, from in a world's view, just as we heard about, the issues around financing, the issues around, having community as a part of those conversations and decision-making, but also global, at a global level. The 8th replenishment is coming up amidst very, very challenging global civil society, bilateral, multilateral, and overseas development reductions. And so I think it would be just sort of great to appreciate the perspective of Women for Global Fund coming towards this 8th replenishment. Alia?
Thank you so much, Dumi, for this really great question. I mean, in places like Morocco, or I think I would speak also on behalf of the MENA region, as I'm working there, we often see some missed progress, not because of lack of ideas or actions, but because, I mean, women-led, feminist, and community-led work is really underfunded. So it is also undervalued. It is also invisible in the official metrics, whether it is GDP or others. So I think as Women for Global Fund, we always urge governments to find innovative way of funding, I mean, feminist, women-led organizations, which doesn't happen often. But I think we should really encourage creating more flexible direct funding streams that goes directly to feminist and community-led groups, and not through some layers or intermediaries that will fund this group. I think it's also important to push the donors like the Global Fund and other international donors to really fund intersectional work and not only see health only as services delivery, but also as advocacy, movement building, also healing justice, knowledge productions, and etc. Capacity strengthening for women in all their diversity, supporting them in resource mobilizations, fundraising, and also to explore different pools of fundings. Explore maybe I'm thinking about the public-private partnerships, and also to encourage that, I mean, domestic fundings goes to women-led groups and also community LGBTQ groups, and ensuring that at least like the Abuja Convention, 15% of the GDP goes to health sector and access to services. And I think in also, I think if we speak about the global south in general, either Morocco, Latin America, Asia Pacific, South Africa, I mean East Africa, we have to think about how we can really reshape and how we can measure our work, because feminist impact is not always quantifiable in the traditional ways, and it means that it's not measurable sometimes. So we need to really document our actions. We need to, because documenting our work can shift power and increase access to spaces for influence, changing the narrative that sometimes is changed because of the work that we do, and also using participatory monitoring, using storytelling, community testimonies, and most importantly, I think using disaggregated data and co-creating indicators all together with other movements to reflect the work that we do, and also the success, how success looks to us, not to the donors or to the governments, how success looks to us, not to funders. And we really need to work together and with partners to really develop this feminist Imani framework, and ensure that our advocacy for gender transformative programs is tracked, is funded, and is valued. Thank you.
Thank you so much, Alia. And I mean, maybe just to also add some of the words that Smitha had mentioned, around safety, that it has key components such as accessibility, environmental and information security, space for informed consent, and equal respect to users of healthcare services, and the need to address, all these different aspects, which I think is quite a lot of critical work that grassroots emerging and feminist organizations are already doing. And it's not always integrated, like you had alluded, within the concept of, linear M&E frameworks, or even just the consideration of whether it's an HIV, malaria, or tuberculosis response. So that being said, I'm going to shift gears a little bit. I'm going to say one word, and then I need you to respond by only using one sentence with regard to that word, the immediate thought that comes with regard to that one word. Since you're unmuted, Alia, I will start with you. The one word that I'd like to use is patriarchy.
I think patriarchy is one of the reasons that doesn't let women-led movement getting more fundings, and also stopping women to meaningfully participate in decision-making spaces.
Great, thank you so much. Albertina, one word I present to you is constitution.
Okay, let us ensure that all the rights that are enshrined in the Constitution exercised, and also let us ensure inclusive health services for all.
Thank you so much. Luz, I'm going to turn to you and say solidarity.
Oh, I love that word. One of my favorites. Solidarity is key for facing the troubling times that we're facing right now. I think the key is to have solidarity and to articulate between inside our own movements, but reaching out to other movements, to other communities that face the same quote unquote enemies.
Thank you. Very long sentence. Smitha, equity.
So, yeah, that is really a great word. I love it. With equity, I would say accept differences, and provide equal and safe spaces so that equity is ensured. Thank you.
Thank you very much, Smitha. Theo, I'm going to say liberation.
You should have made me first.
Sorry.
Okay. I will borrow the first word in creating my sentence. The liberation of women.
Liberation, not deliberation, liberation.
Yes, I said the liberation. The liberation of women's rights will be the downfall of patriarchy. I really wanted patriarchy. So yeah, if women are liberated, that will be the downfall of patriarchy.
Great, thank you. And so as we close off this conversation, I am going to then ask, what should we start, what should we stop, and what should we continue in ensuring that, all women and girls are met where they are in their communities, in the context of, cultural, religious, and social dynamics and nuances. So maybe I will start with you, Albertina. What should we stop? What should we start? And what should we continue to ensure that all women and girls in their diversity have got access to health and can be the most highest attainable form of health and well-being within our variant contexts across the global majority?
We should stop gender-based violence and discrimination, and then we should ensure that we implement community-friendly health services and promote gender equality and LGBT, including LGBT rights in health services.
And what should we continue?
We should continue putting in place women, girls, and disability and the other key vulnerable populations' rights.
Thank you. Thank you so much, Albertina. I'm going to turn to you, Smitha. What should we stop? What should we start? What should we continue? And maybe let's target funders for this.
Okay. So for both funders as well as for the administrators and the society at large, we should stop the barriers, whether it is environmental, infrastructural, informational, communicational, or financial barriers. We should stop, and we should continue solidarity. We should continue collective efforts towards effective administration and towards change making and towards getting more finances for healthcare systems and for healthcare services of all with disabilities and other vulnerable groups. What I miss, we should start. So what we should start is we have to start with political participation, because political participation is a game changer and we need to take it very seriously, so that whether it is the funding or whether it is a data issue or whether it is a community, everything can be, what decision making we can have experience built towards equity with all these things. Thank you.
Thank you very much, Smitha. I'm hoping the captions captured that. But this is very telling, and I think it's all the more justification of why we need this to be in an in-person panel somewhere in the near future. I'm going to turn to you, Alia. What should we stop? What should we start? And what should we continue in ensuring that the 8th replenishment is reflective of the needs, dreams, aspirations, and as per Lucy's words, knowledge of diverse women and girls across the globe?
Thank you so much for this great question. So for me, what we need to stop is we need to stop inviting women and communities just to tick a box. We need their meaningful participations, which means shared power, having them at the decision-making tables and taking into consideration their voices, their needs, and their priorities. We need to stop criminalizing women's choices and leadership. and we need to remove colonial law, stigma, and moral policy that have no place in public health. What we need to start is to think about innovating how we finance gender justice. We need to really redirect resources to the grassroots, to women and gender diverse individuals who are building the solutions at a grassroots level, and who knows their communities better than anyone else. And we need to really continue advocating for gender transformative health programs at every level. And I'm talking about starting from community dialogues to global policy tables, like the Global Fund board meetings, like the UN meetings. And we really need to strengthen and continue strengthening and resourcing women in all their diversity, women movement, and especially those led by young women, women living with HIV, trans women, sex workers, who can really drive change and shift the power. Thank you.
Thank you so much, Alia. Lewis, I'm going to turn to you. What should we start? What should we stop? And what should we continue, especially in ensuring that women and girls can be at the forefront, meaningfully engaging in global policy-making spaces, and obviously ensuring that all forms of safety can be secured within those spaces?
Thank you. I'm looking inside movements, and I think we have to stop focusing on our differences. I think that's something that I don't know. It's very convenient to anti-rights movements when we focus on what divides us, and we don't focus on what keeps us together. So I think we have to start. I think we have in a way, but we have to start working more connected and together than ever between communities. We face the same issues, just different faces of the same issues, and we have to work together against them. And in that way, we will be able to continue the path that we and our ancestors started to guarantee our rights. We do not have to forget that this is not something that's starting today. It started decades and hundreds of years ago with many women, girls, and diverse people standing up for their rights. And we have to continue that legacy to achieve what we want to achieve.
Thank you so much, Luz. And so we'll be closing with Theo. What should we start? What should we stop? And what should we continue? Looking specifically towards, let me say, private philanthropy, private funders, because obviously in many criminalized environments and in many intolerable environments, usually those are the ones that we can tend to rely on. And so what do you think that we should stop, and continue targeting specifically those stakeholders? Yeah.
Hi, Dumi. So I think we should start raising more awareness to private funders on the work that needs to be done, that we've been doing, and that needs to continue being done. I think we should also start viewing intersectionality on a greater lens. We, like Luz said, we all fight the same fights in different ways, but my fight to me is your fight. And if I have to stand up for you, you should stand up for me. If people in Morocco are going through a crisis, women in Morocco are going through a crisis, we should be there for them as they should be there for us. It's a global fight. And like the previous person said, this started hundreds of years ago. We should stop facing, again, this comes back to what I just said. We should stop facing each other's troubles as they are not ours. I heard recently that the disunity amongst women benefits the patriarchy, and that is so true. We should stand up as women. We should stand up as female-bodied people. We should stand up for the girls and for the children, and highlight everyone's issues and make it a global thing. What should we continue? Continue offering safe spaces. I think I have seen a dwindling of safe spaces for women, girls, marginalized persons. I have heard it in the region, and I have seen it even in my country. I think we should continue trying to create safe spaces especially for marginalized people. Yeah, I think that's what we should do.
Thank you so much, Theo, which I think is the very purpose of trying to stimulate South-to-South solidarity and ensuring that all these different beautiful insights that we've just heard in this last hour can not only cultivate and hopefully pollinate across women's rights movements across board, but also strengthen some of the key sectors that are very critical to the success of gender justice, that are very critical to the success of climate justice work, that are critical to queer liberation, recognizing the variant forms of violence, recognizing the barriers to meaningful participation, and recognizing that not all of us can actually thrive in the environments that we're in as a result of, socioeconomic conditions, as a result of criminalization or colonial laws, and essentially a lack of political will. And so that being said, I'd like to thank you all so much for being generous with your time, your expertise, your insight, your lived experiences. And I truly, truly hope that this recording can be something that can be meaningful, that people can move forward with. And I wouldn't be surprised if this can end up actually being somewhat of an abstract for a conference somewhere. And so that being said, thank you so much. I think just from this conversation, it's really reflective of this year's theme of World Health Day in the form of healthy beginnings and hopeful futures. Thank you, thank you, thank you.
So much to me. Thank you, everyone.
Thank you. Thank you so much. It was a great conversation.
Thank you and bye.
Bye bye.